With that said, I'm going to run into our first question. This deals with the hospital system. Very big issue. Okay, again, verbatim. The hospitals are facing a budget shortfall next fiscal year, such as the Hilo Medical Center. This will result in layoffs with an estimate of 87 employees. What do you plan on doing to help avert this? I guess both Speaker Suki and Finance Chair Luke, maybe?
Yes, actually the whole state is having a problem, but more so in the neighbor island. So just to give you an example, Maui took it upon itself this last session that we had to pass legislation to allow for a transition from a state government-run hospital to a private non-profit run hospital. And at this point here, the hospital have been selected who they're going to be working with, and the governor now is in deep negotiation and the advisory board and HCOC with the chosen hospital, which is, by the way, Kaiser. Now, the plan is not to be a Kaiser-run hospital, but a community hospital. Totally different than it was with Maui Memorial, and it is with Kaiser. It's a community hospital, and Kaiser is well aware of that. It will be run as a community hospital. And so what they are doing, we hopefully, with this transition here, and making some adjustments as we move along, that we can improve the medical care. In fact, we are very optimistic if the negotiation is complete, we would be able to have the kind of medical care that we all need and deserve. And so this is the process that we're doing now. The genesis of all of this is that, as you well know, that the state, of course, is never have enough money running the schools and the health and everything else that we do, social services, Medicaid, which is a huge, huge gap. And all of this together doesn't give the state the flexibility and the dollars. And we've attempted in the past to try to see if we could enhance the revenue situation, but that has been to no avail. So as a last straw, we went into looking for a private non-profit hospital, and that's going to be quite different than a state-run hospital with the employees was going to be private non-profit employees and not state employees. That's where we are, and we hope they can resolve this negative situation that all the neighbor islands, especially Maui, is having. But my understanding, the Big Island is beginning to have some discussions now themselves. So we have legislation that's available, and we'll see what comes about. Thank you. Maybe well, you can clap if you wish.
You know, the Finance Committee, we recently toured the Hilo Medical Center and some of the community hospitals in the Big Island a few weeks ago. And you know, one of the things we were told at that hearing or that site visit was that Hilo Medical was talking to a private hospital, Adventist, and you probably heard about this already. And Kona Hospital is in communication with Queens about services that Queens will provide. You know, what happened in Maui Memorial is unique to Maui Memorial because it was community driven, and the community at that point, about 5 years ago, the community had a discussion and they didn't want a public-private partnership. But this go around, they felt that the community supported and the community wanted some type of a negotiation. So any type of public-private partnership, it has to come from the community. So it really has to be, what does the residents of the east side or west side want out of the hospital. Maybe it's that, maybe it's not. Maybe it has to be, oops, sorry, okay. Oh, no, it's okay. It's okay. Maybe it has to be not a public-private partnership, but some kind of a memorandum of agreement with a Honolulu hospital or whatever it is, and then increase medevac services. Because say that in Hilo you can't get a bed. Somehow we need to get you folks either to Kona or Wilcox or Queens or wherever it is. And the other thing is, I think the regional hospital, the system here is doing a terrific job. You know, we visited Hilo. Hilo is doing a terrific job. I can tell you that. The thing is, I think there's a little bit of a disconnect between the region and the state system, because when the state system came to the legislature and asked for money, the state system wanted to double the subsidy. So they wanted, instead of 100, which they get from the legislature, they wanted 200. And any reasonable person looking at that, it's gonna raise a red flag. When we talk to the Big Island region, what they were asking for is increase it by about 30-something million. I think 30-something million is doable to take care of the needs of the community, but when the region, not the region, when the state system comes in and automatically asks for an additional 100 million, I think that kind of puts a little bit question. So I think there needs to be better communication between the system and the region, because the community is what counts, not what the state central system say is right.